My name is Lawrence Arjon. I'm a family physician and I've been practicing family medicine at St. Margaret's Hospital in Pittsburgh for over 40 years now. During my year as president of the Pennsylvania Medical Society, I worked very hard to raise the awareness about a very, very, very large concern and issue with physicians, which is physician burnout, physician wellness, and physician suicide. Over my career of 40 years at St. Margaret's, I have seen multiple colleagues of mine commit suicide, and the amount of trauma and tragedy and sorrow that this created after their death was unimaginable. And this is one of the things that motivated me during my year as president to try to get this out as a public service message to the entire physician community. My project started before the pandemic, and we now know that with the pandemic, this issue has increased significantly. The issue of physician burnout, suicide persists, and the pandemic has certainly exaggerated and magnified this tremendously. As we know, even before the pandemic, it was discussed that over one physician commits suicide a day every year in this country. That is equal to one medical school class graduation per year. Over 300 physician suicides a year should not be ignored. I know this has been studied by the experts and it's been discussed in the medical literature, but we must work very hard to increase this awareness in the medical community. In addition, we as physicians usually have close contact with these colleagues who are struggling and suffering, and we need to look very closely at any change in their behavior, any change in their appearance, any change in their professionalism, and reach out and try to help them as quickly and as completely as we can. We need to remove the stigma of physicians looking for help, seeking help, and accepting help when they need help. And we as physicians certainly should be able to extend a hand to our colleagues in order to help them prevent this disastrous decision that they might be on the verge of making. My year as president was so fulfilling and so worthwhile in trying to get this message out. And once again, I tried to heighten the awareness of this major concern of physician suicide in the medical community and ask all my colleagues to reach out to any of their friends, partners, associates that may be struggling and could benefit greatly from your help. I greatly appreciate you accepting this challenge, and hopefully this is a situation we'll be able to reverse as we move forward. Thank you very much.